Welcome to the February edition of the Region 8 EMS Paramedic Educational Program. You're probably wondering who I am. No, I'm not some schmo off the street. I'm the new EMS Director from CDH, Steve Graham. I trained at Christ Hospital, stayed there for a few years as an attending, had various positions in Pennsylvania and then McNeil Hospital, and currently I've been working at Central DuPage Hospital since 2001. I took over for Herb Sutherland January 1 of this year as the EMS Director in our system. This month we're going to discuss blast injuries. We're going to discuss the mechanism of injury and how we treat them. There's several components to a blast injury. However, before we start getting to the nitty-gritty of how we treat such injuries, let's take a look how they occur. That's perhaps one of the most impressive displays of power we've ever seen in humanity. Hopefully we'll never have to deal with any sort of trauma or injury related to such a devastating effect. However, notice the pressure wave after the explosion, and you can see truly how a blast of that effect can manifest its power, energy, and damage. Let's put it in a real-life scenario and put it more realistic explosion that we could see. And as you watch the next video, think of the ways that you could be damaged both in or outside this vehicle. As you can see from the exploding train video, your injuries could vary depending on whether you are inside, outside, how close you are to the explosion, or how far away. There's two main types of explosions. There's a high order explosive and there's a low order explosive. They're mostly differentiated by the fact that a high order explosive has a blast wave. However, both high and low order explosives can cause significant injury. Injuries from a blast occur by four different mechanisms: primary, secondary, tertiary, and quaternary. Primary blast injury occurs from the pressure wave formed from the explosion. The closer you are to the pressure, the more damage that would occur. Think of air causing problems with other air-related structures. The primary things to get damaged are your eardrums or tympanic membranes, your lungs, and your bowel, particularly the colon. Besides a perforated eardrum that you may see, you may manifest with respiratory complications. There may be dyspnea, hemoptysis, crepitus to the chest wall, tension pneumothorax, and other sort of respiratory complaints. These can manifest up to 48 hours after the injury. Additionally, the colon or bowel can be injured, and that also may be a delayed presentation, but abdominal pain related to a blast injury may be from a primary effect. Secondary injury is caused by the flying debris from any explosion. The primary thing that we see causing injury is glass. However, it could be metal, wood, or some other object. As evidenced during the Boston Marathon explosion, bombs can be covered in metal fragments that can cause a significant amount of damage. Also, one could get a blunt injury from a piece of wood or some other object being blown into the individual and hence causing injury that way. Tertiary injury results from the person being thrown into objects during the explosion. Some also state that tertiary injury is a result of objects that possibly could collapse or be blown into you. Quaternary injury is a result of injuries that occur unrelated directly to the explosion but may be a result of burns, exacerbation of asthma due to particles, debris, or gases, angina, or some other medical condition that might get exacerbated due to the blast effect. Even though these categorizations sound really cool, what do they really mean? Probably nothing. It's all research related and driven, so we can talk about things after they occur. What's important is what you find when you get on the scene. First, scene safety. Don't go into any situation that might be dangerous, whether it's a fire or an unsafe structure or something that's going to collapse, or there may be somebody that perpetrated the crime and is still on the scene and has some sort of other weapon, or you see possibly an unexploded device in the vicinity. So worry about your own safety first. Second, treat this like any other trauma. What's in front of you? Airway, breathing, circulation. Once that's stabilized and assessed, then you get onto a secondary survey. I think one of the most important things about blast injuries, as I can recall from the Boston incident, is the fact that with the penetrating objects that can be sent out from the bomb, you really have to be cognizant of massive bleeding, and that has shown that the use of tourniquets can be very helpful in the treatment of such injuries, and perhaps life and limb saving. Additionally, crush injuries may be a significant component of any blast injury. Think of that if a limb is trapped under a heavy object for a significant amount of time, maybe causing some increased compartment pressure, damage to the muscle, which could lead to rhabdomyolysis. If you feel somebody's experienced a crush injury, fluid hydration is essential, as well as some would propose, if a large muscle group is considered crush, to add sodium bicarbonate to the saline to prevent possible rhabdomyolysis side effects, including renal damage. If there's any concerns about whether that therapy should be instituted, I would consult medical command. In summation, blast injuries are a combination of barotrauma, penetrating, and blunt trauma. One, two, or all three can occur. Just follow your SOPs, treat accordingly, and do the right thing. Hopefully you're still awake by the end of this, and I promise the next video will be a little bit more entertaining. It's my first stab at this. Give me a little chance.